Hello, I'm Salam at Bisa Dental Clinic. I'm happy to be with you again in the middle of summer season. This Dentium live and follow-up session always connect you and me. As always, today's live surgery will be performed by Dr. Chung. The topic for today's surgery is simple implantation and A.R.P on lower anterior area using bright TL system. You will be able to learn the simple implantation concept and how to easily perform implant surgery on lower anterior narrow ridge. We are going to do a brief review before moving on the surgery. Okay, let's take a look at today's case. As I mentioned before, a simple implantation and A.R.P is today's key point. About the patient information, 81 years old male patient. He got lower chip complaint. My lower front teeth are uncomfortable, so he needed some more treatment from this situation. Dental history, flap operation, and GBR procedure on lower left premolar 6 years ago. And he got the medical history about the cardiac surgery, and also he took a medication, anticoagulant. It is oral exam, the panoramic view of our patient. Can you see the lower anterior area? 6-unit breeze from canine to canine. However, the 43 canines are failed or some discomfort due to periodontal disease. So that is a big problem and issues to our patient today. About the CT, cone beam CT view, we can recognize clearly about 31 and 41 area, extremely narrow ridge, about 3 millimeters. So narrow the ridge. So that is a big issue today's surgery. Intraoral view here, 6-unit breeze, some failed, and the gap, we can find the gap between the prosthesis and the abutment tooth on 43 area. So finally, 43, the lower right canine was extracted with breeze removed. And today's surgery plan is as follows. Narrow implantation on 31, 42 area using bright tissue level. And simultaneously, Dr. Chung doing the socket preservation using osteon genocollagen and collagen graft 2. That is collagen matrix, a brand new product from Dentium company. About the minimalism in GBR concept, actually, this recipe is a best combination for make GBR easier. What is a main component of the recipe? First, bright TL fixture. And the second, osteon genocollagen as a bone graft material. And third, collagen graft 2, the collagen matrix as a barrier. About the bright tissue level, as I mentioned before, I told about this tissue level many times. This unique design, the fat belly style, the middle portion of fixture is bigger diameter, bigger size than apex and the top portion. So thin, deep, sharp thread give us higher insertion torque when you have osteotomy and implantation. So this sharp thread and also this fat belly style unique design gave us higher initial stability than any other implant system. That is big advantages. First, big advantages. And number two, unique portion is here, top portion of fixture. Tissue level, external connection type. So looks like a built-in screw abutment style. About osteogenocollagen, this one is the collagenated bone graft substitute material. So combined with the bovine origin particulate bone and collagen binder. This collagen binder came from porcine. So they intermingled each other, 90% particulate bone and 10% collagen binder. So that make it easy to molder on the surgery site. So it is a big advantages, moldable, easy handling, right? And sometimes we want to see this osteogenocollagen make a new bone formation on GBR site than the particulated bone. About the collagen graft too, this one is this product, actually collagen matrix product, so unique and versatile, very versatile, the collagen graft matrix actually. So the usage of this collagen graft 2 as a collagen matrix, number one, actually we're going to use this product on the A.R.P. combined with the xenograft like osteogeno. And number two, we're going to use these the collagen matrix instead of a barrier membrane. So if any discomfortness or have some trouble to use membrane during the GBR procedure, you're going to choose, if you can choose this collagen graft 2 instead of a stiff the barrier membrane, you can feel better. You can feel better, much better, because of this collagen graft 2 gave us higher epithelialization, promote epithelialization from the soft tissues, so easier the soft tissue closing, even though when we have open membrane style, the wound healing. Okay, let's move to a similar case today. Simple implantation on narrow ridge using pin guide case. Also, the lower anterior case. So what about this one? The extremely restricted narrow ridge site, number 42, 32 area. So almost under 3 millimeter, the apex portion. So what kind of implant picture is available for this area? Internal connection, the bone level picture style, the how much diameter. So that is big issues for us. So however, if you choose this bright TL, the replace, and the solving the problem, whole of this discomfortness and issues, the diameter on the bone level picture. So the procedures as follow: extraction with a crowding anterior, 4 anterior lower teeth, and using the guiding pin. This guided pin working as a bone mapping tool, the analog type bone mapping tool. So the insertion between the soft tissues and bone surface. So we can recognize clear the bone shape, morphology, and the volume. And after that, we're going to start osteotomy. Sometimes we're going to use the flap-less surgery. Sometimes we're going to use this drill, this procedure, the open flap style. So after the final osteotomy, we're going to do check parallel pin for the tests and depths, and the osteo3 collagen, put the socket area, and implant fixture installation. At this time, bright TL diameter 2.5, 11 millimeter was installed. Number 42, 32 area. 2 implants supported 4-unit bridge will be restored. The ordinarily speaking, as you know, for lower 4 anterior teeth is not full the same number of implantation. It is not necessary, right? So the ordinary 2 implant is enough to support for the natural lower anterior teeth. So 2 implants is enough to make a superstructure will be 4 unit bridge, right? So after that, we're going to connect this scan abutment, a very useful and versatile scan abutment. Connect this picture top portion, and you can see these bone graft materials between number 32 and the 42 area. Because of these areas destructive already, so we need bone grafting. So osteogene collagen was applied to compensate this depression. And the collagen graft 2 was applied also to cover this open area. And the suture and the scan. And after that, we're going to make a temporization prosthesis using this scanning, right? And sometimes we're going to use this scan abutment as the temporary abutment directly for temporary processes. However, this time actually we're going to use just the scanning and healing the purposes. What about this cone beam CT after insertion, number 42 and 32 area? Exactly insert into the cancellous bone, these implant fixtures engaged only cancellous bone. So very well done insertion. And this implant fixture doesn't give any harm on top portion of the ridge. So it means preserve, keep the ridge, the cortical bone area, the ridge area. So we can extremely reduce the exposure of top portion of the fixture and also resorption of top portion of residual bone area. That is big advantages when you're using this bright tissue level implant fixture system. And healing status after 1 week, very faster soft tissue healings are seen on the collagen graft applied area. And intraoral scan here for the making temporization, and the scan CAD program make a temporary restoration on the CAD. And after that, finally, we can get this temporary provisional restoration. So connect with the implant fixture. And also sometimes we can get the resin bond helping the natural teeth support. The shade taking for the final restoration and scanning again for the verification. Sometimes we're going to use this BTS system. BTS concept means bite tray impression style. This one is a little bit different using intraoral scan. So if you don't have intraoral scan, don't worry, it doesn't scale because of you're going to use this BTS concept, just bite tray with using rubber impression material, connect with the scan abutment, and then send to your laboratory. Your laboratories make this negative impression area, the scanning, and finally the flip to positive, the picture, and the final restorations will become. Okay, so final restorations delivered to our patient, like here. So I think very nice, well done. The final restorations, zirconia, the final restorations, cause of restricted mesiodistal distance. The only 3 unit bridge was inserted into this area. Okay, let's move to today's surgery. As I introduced to you, already this 6 unit bridge was removed, and the number 43, the canine, was extracted. and the crestal incision was made, and the clavicular incision using this explorer. Sometimes Dr. Chung preferred to use a periodontal curette, the explorer, and some other devices. The instrument was applied to cross-checking the clear cutting, this crestal incision and clavicular incision. And the flap reflection. So at this time point, actually, we already get the full information about this lower anterior ridge area from the cone beam CT view. So if you want to have a flap laser surgery, you're going to use a pin guide and not open the flap anymore, just the osteotomy drills are used and the implantation will be done. However, Dr. Chung flap reflection and some of grafting materials with granulation tissues are removed now on number 33, the canine medial portion. Okay, flap reflection, a little bit more, the lingual side, and whole remove of these already inserted graft materials with intermingled connective tissues. Here's going to make a vertical incision to promote flap reflection more. Always the vertical incision start with the line angle of neighbor natural teeth, the ordinary distal line angle, or the next medial line angle of the next neighbor teeth. So the flap reflection, removing more granulation tissues. Yeah, we can see big pocket, big defect on number 32 area. So this area is not good for the implantation today. So target area is number 31 and 42 area. The root planning was performed by periodontal curette. Root planning is very important procedure when we have the implant surgery also. Cause of neighbor teeth root surface is very important factor to faster and healthy healing, right? So before bone grafting or before implantation, you should check the neighbor teeth, the medial or distal root surface intact or not. So if you find out some granulation tissues at the pathologic region, you have to remove all these, the pathologic tissues cause of the healthy healing procedure, the promoting healthy healing procedure. Sometimes Dr. Chung used this round bar, high-speed round bar, or sometimes he's going to use low-speed round bar to remove the remnant of granulation tissues and the softer bone. And this instrumentation is very versatile to multi-purpose usage, removing granulation tissues and grinding out some bone spicules. And the surface bone activation. There are many purposes using this round bar. This time, the straight hand piece with connect with round bar was used. Yeah, depend on your decision. Actually, this number 43, the lower left canine, that can be extracted due to this big mesial defect. So, however, Dr. Chung is going to have conserve these teeth because of many purposes, I think. First one, he want to maintain these, the canine tools, cause of this canine is very important key tools, as you know. Number two, actually this one is, he hope, expect this canine tools as some the temporization supporting as a temporary supporting tools. So today, Dr. Chung is going to have a two implantation only on this narrow ridge. So these two implant with the temporization for the 6 anterior areas is too wide. So sometimes have some harmful to the bone regeneration and also integration. So this canine number 33, canine is very important, the position for the maintaining temporization during healing status. Okay, can you see the high-speed bar? Sometimes this the thick cortical bone plate area, so you're going to use this high-speed small round bar instead of Lindemann drill. Why? Because of this dense area, cortical plate areas have some easy to slippery when you're applying the Lindemann bar or the final drill. So before starting Lindemann or final drill for the osteotomy, this high-speed round bar will be used for proper positioning. That is a good choice. Okay, so once more, at this time, he is using the number 330 fissure, small, the head fissure bar was applied for this area. Okay. I can see this major part of number 33 canine areas, two wall defect. And this socket area, number 33, the canine areas maybe looks like a three wall defect, two wall defect. So this wall defect is acceptable to make a regenerative procedure, like a GBR procedure or simple bone grafting using this with collagenated bone graft material. Okay, he is going to start final osteotomy with Lindemann style final drill. Nowadays, there are two available, the final drills in the kit of a Bright implant system. First one is regular style, the osteotomy drill. Another one is Lindemann style drill. So just before, did you see which was seen to you on this surgery? Okay, so 3.0, 11 millimeter, right tissue level was inserting here. Yeah. This implant system have a 1.5 gingival cuff the only one gingival cup. So some users have confusing cause of the single gingival cup, cause of they want to choose a different height of the gingival cup depend on tissue thickness and the insertion depth. However, Dr. Chung developing this bright tissue level only one the gingival cup system 1.5. Sometimes that is discomfort this. However, sometimes that is a big advantage. Cause of 1.5 means short neck but strong, right? So totally eliminate the neck fracture, the problem. So that systems have a strong neck, so they endure some of pressure. So strong, free from the neck fracture. Okay. Now he is going to have bone grafting on the socket and the mesial bone defect using this osteogenocollagen that was introduced to you at the introducing slide. This osteogenocollagen composed of 90% particulated bone osteogeno from the bovine and 10% collagen materials working as a binder from porcine high bone collagen. So this porcine derived type of collagen is easier to resorb than any other type of collagen. It means the faster resorption of collagen make a space to make a new bone formation during the bone, the regeneration process. Sometimes that is big benefits to us during bone regeneration process. And after that, the collagen graft that was introduced to you already. So the collagen graft 2, this collagen matrix is very versatile and useful, like this A.R.P procedure. And also this graft materials will be used GBR procedure. This collagen graft 2 have two different layers, the dense layer and the loose layer, right? The dense compact layer should be the top portion, the facing to outer area, cause of more dense portions to protect inside of the bone graft and to prevent the invading the soft tissue cell from the outside. Small the punctures and connect with the skin abutment directly without any suture or pin fixation, right? So very simple, the last pin. How these procedures are possible? Cause of the secrets are there, the picture, right? Even though 3.0 diameter, these pictures narrow but strong. So whole implant fixture bodies engage into the host bone, the cancellous area. So that is a big secret to make possible this simpler bone grafting procedure. Let's see, 3.0 diameter, the bone level internal connection is possible to insert this area? Yes, possible. However, after insertion, this smaller diameter, like a 3.0, the bone level implant system, I think you get sometimes you got some the nightmare. Why? Because of this narrow diameter, implant fixtures sometimes broke or the crack will be happen due to very thin the fixture were. However, the same diameter 3.0, this bright tissue level, it doesn't have any problem, doesn't have any issues about this fracture and crack. So I also prefer to use this bright tissue level on the lower anterior narrow ridge area. I think this bright tissue level is perfect cover this anterior lower and the premolar area, upper and lower both. After insertion, if we get the enough insertion torque, we're going to directly the chair side temporalization using temporal resin is possible. Sometimes you're going to prep this 3-in-1 abutment with a high-speed bar, like a dual abutment for direct temporalization, the same day the temporalization on the chair side, the same concept. Okay, so I think he need a bone grafting a little bit more because of when you have a bone grafting with this depression area, big defect area, a little bit over grafting, over contouring is better than under contouring due to cause of bone graft materials shrinkage, the phenomenon, right? Especially some kind of graft materials is so higher shrinkage percent, especially porcine bone origins is a little bit higher the percentage, shrinkage percentage than bovine origin. But anyway, this xenograft have some the shrinkage and the potential. So I recommend you a little bit over contouring when you have a bone grafting. The GBR also just a simple bone grafting also. Okay, is modified the matrix sutures. Yeah, he tried to make a modified matrix suture style. On the labial side, the horizontal matrix suture style, and the lingual, a little bit looks like a vertical matrix suture style. The combined the both of matrix suture style. Anyway, all of these interdental the tissue areas was in proximity, have an in proximity by suturing. Okay, the socket area, this area was done by A.R.P procedure using osteogenic collagen and collagen graft 2. But that is very simple, the last P, to make A.R.P easier. So even though the two implant, the fixture, these two implant fixtures enough to support 5 unit dentureless area temporalization. In my experience, this bright tissue level is much better than the narrow diameter bone level picture system. The big one is the smaller diameter. However, to eliminate the fracture, the issues, right? Fracture or crack issues. Cause of 3.0, 3.5. 3.5 is okay. However, 3.0, 3.3 always have a risk to breakage or leakage and crack and fractures or fixtures due to the thin wall when they connect with the button superstructures, abutment, and the internal portion of implant surface, internal connection type, right? So always have a tendency, this kind of risk. However, this bright tissue level doesn't have any risk factors about this, the harmful effect. So lower anterior area, 2.5 or 3.0 diameter is enough. He is doing the finishing line to make a suture nut on vertical area. Okay, I think almost done. Oh, as I expected there, yeah, he is going to prepare get some more bone grafting on this defect area because of the bone grafting material is not enough volume to cover this big defect. So he is preparing another bone graft materials. Yeah, osteogenic collagen, the same as before. Yeah, there's osteogenic collagen. The dry status, a little bit hard. However, after once soaking to saline or the blood, as you can see, the so softer. So you can easier the handling. You can get the easier handling and molding. That is the unique properties of this osteogenocollagen, the collagenated graft materials. There are many different kinds of collagenated bone graft materials from the many different companies. So, for example, the same as bakery, right? So there are many bakery make bun, made the bun by themselves, but however, their recipe is totally different, depend on the bakery, right? So this collagenated bone graft material is the same situation, depend on the molding tools and the particulated bone source and the collagen binder source. All of these harmonious combinations make the best the performance to give a best performance. So depend on company, depend on the graft materials, and a little bit different the physical properties available and given to you. So you have to evaluate before using on your surgery. This osteogenocollagen have a softer, little bit the softer bone block category. right? So this one is this ostensible collagen is classified with a softer the collagenated bone block category. The bios collagen is hard the collagenated bone block category. So different usage and different performance depend on the physical properties. Yeah, I think, yeah, this volume is better than before. And this collagen graft 2, the collagen matrix, looks good, always looks good ever. Okay, so yeah, he finished and then inject PDLN. And this is, looks like a salmon injection. So it came from the salmon. Okay, the finishing all the today's surgery, and we will get the 10-minute break, and then we can get the Q&A session. Thank you for watching. Yeah, I have a tune. Yeah. Hello, doctors. Thank you for waiting. Before starting the Q&A session, I'm going to show you about this result of today's surgery. Our session's name is Surgery and Follow-up. So we're going to see the after surgery result. The post-op view intraoral pictures are here. As I mentioned before, number 33 area, the lower left canine, the mesial portion, big defect covered with the collagen graft 2 underneath the osteogenic collagen, as you can see. So the volume is good and also have the over-contouring. So what do you think about this opposite area, number 43, socket defect areas? I think it's good. However, if possible, the bone grafting a little bit more, the compact feeling will be good than before. And after 1 week, we're going to see this healing status. The very nice, the faster soft tissue healings was seen to us. So all of these the procedures and these healing procedures came from the soft tissue familiar, the friendly collagen graft tooth, the performance, and also combined with the PDRN action. And after that intraoral scanning, from the intraoral scan, we can get the scanning and the information all about this surgery area. It's sent to our laboratory, and our laboratory have a CAD design here, and the 5-unit temporization will be made, including this 33, the canine, the natural teeth abutment included also. So totally 6, 1, 2, 3, 4, 5, 6 unit a temporary bridge was delivered to our patient. So even though this number 43, the canine areas, the working as a panic, however, don't worry about it. Cause of this number 33 is a strong abutment, the natural tooth abutment. So the possible and is acceptable, even though only 2 implant fixtures supported the 5-unit temporary bridge, cause of including these canine natural tools. After provisional restoration, this one, the post-op panoramic view, obviously we can see clear 2 implant fixture, diameter 3.0, 11 millimeter, bright tissue level support, this 5-unit, the bridge, including this, the natural tooth abutment, number 33. So strong and stable, the stages during healing period. So this, as you can see, the thread, even though the smaller diameter, the sharp thread, so gave us a maximum engagement between the nature bone and implant fixture surface. So that is a big factor, the big benefit and important factor to get the higher insertion torque when we have this bright tissue level, even though the narrow diameter, when we have smaller, the narrow ridge area, like a lower anterior. What about this healing status after 2 weeks? Even though the soft tissue is a little bit shrinky compared to before, however, the well-organized, very nice healing status was seen. Okay. Here, the one good question. What are the special advantages of using bright TL for simple implantation compared to traditional methods? As I mentioned before, this bright TL have a big benefit compared to the traditional method. This traditional method means the internal connection type bone level implant fixture with the bone grafting, like as a GBR procedure. First one, this bright tissue level, the washout, all the worry about the fixture blockage or the fixture fracture, even though the smaller diameter, right? So the compare to each other, for example, 3.0 diameter, bone level, and tissue level. Which one is better? Which one is more reliable to us? Actually, this tissue level is much better and reliable on this narrow ridge. So that is big benefits when you choose this bright tissue level on the narrow ridge. And number two, the next benefit is here, reduce bone grafting procedure, right? The cause of this bright tissue level is a good recipe to minimize GBR and minimize bone grafting the procedure. Why? This bright tissue level reduce the exposure of surface of implant. Cause of is the gross anatomy itself. As I mentioned before, the fatty belly style design, the top portion is narrow than the middle portion. It means the easy and much better to conserve the marginal bone barriers. So no harmful anymore, the marginal bone, this bright tissue level, right? So we can keep, even though the smaller the bone volume, the ever. So I think this big two benefit is special advantages, the bright TL, compared to traditional method. So let's see the better connection, the stable connection. We're going to use the little bit wide diameter compared to the ridge width. So for example, 3.5 diameter bone level implant fixture on 3.5 the narrow ridge. Maybe some part of top portion implant fixtures will be exposed. So after that, we're going to do bone grafting. Some doctors want to have a perfect GBR procedure using barrier membranes and releasing incisions, vertical releasing incisions, or periosteal releasing incisions, the whatever. So the surgery is bigger and bigger and complicated. So these complicated procedures always give us a higher risk than the simpler way, right? So, and the bright TL extremely reduce that kind of risk and that kind of complicated procedure. So I strongly recommend you this bright tissue level, especially on narrow ridge area, like today's surgery style, the lower anterior, also the premolar area is very good, the candidate for the bright tissue level. Okay, that is my answer. Thank you for watching. And this time is actually the 8 o'clock in Korean time. 3시 따자. Actually, great thanks to the Chinese doctors especially, and also Vietnamese doctors. Cause of these two big group is the main audience. And also another countries, worldwide doctors also, I deeply appreciate to attending and joining this our live and follow-up session. 谢谢大家. Xin cảm ơn. Thank you. Bye. We will have a next time, the August 23, August 23rd, the same time, Korean time, the 7 p.m. We will have another live surgery session. Thank you. Bye.